my name is Kat Sessery. I'm a nurse practitioner student, and I'll be performing a physical exam on the head, eyes, ears, nose, and throat. If at any point that you feel any pain during this exam, just let me know, okay?
Okay.
Okay, I'm first gonna inspect the face. The skin is appropriate for ethnicity, and the head is normal cephalic in size. I'm gonna palpate the scalp. Any tenderness?
No.
Okay, I'm gonna palpate the temporal artery. Palpate the temporomandibular joint. Open for me. Close your mouth and move your mouth from side to side. Okay, no clicking noted. The temporal mandibular joint is intact. I'm now gonna check for face symmetry. Can you smile for me? Okay, make a frown. Puff out your cheeks. Raise your eyebrows and make an angry face. Okay, the face is symmetrical. I'm now gonna assess the throat. I'm gonna look at your trachea, palpate your trachea. Okay, can you swallow for me? Okay, perfect. And now I'm gonna assess the thyroid gland. Can you tilt your head forward to the left and now to the right? Okay, perfect. So the thyroid gland is non-palpable. We're now gonna check the range of motion in your face and neck. Can you look up to the ceiling? Okay, look down to the ground. Look to the right. Look to the left. Okay, touch your left ear to your left shoulder and your right ear to your right shoulder. Okay, full range of motion of the cervical spine is intact. I'm now gonna check your lymph nodes. So I'm gonna palpate them. Okay, I'm palpating the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular. Okay, the lymph nodes are non-palpable. Okay, we're now going to perform an exam on your eyes. First, going to inspect the eyes. The eyelash hair and the eyebrow hair is evenly distributed bilaterally. I'm going to inspect the conjunctiva. Can you lower your lids for me? Okay, the conjunctiva is pink and the sclera is white. Okay, we're now going to perform a test on your visual acuity using the Snellen chart. Okay, can you cover one eye for me and read the lowest line that you're able to?
D-E-F-E-O-T-E-C.
Okay, now do it on the other side.
D-E-F-E-O-T-E-C.
Okay, now do it with both eyes uncovered.
D-E-F-E-O-T-E-C.
Perfect. So we're now going to check your near vision. I'm going to hold the card 14 inches away. Can you read the line?
L-T-F-E-H.
Okay, so you have 20/20 vision. We're going to check your peripheral vision now. Can you cover your right eye? And I'll cover my left eye. Let me know when you see my fingers.
Now. Now. Now.
Okay,
Now. Now. Now.
perfect. Okay, peripheral vision is intact. Now I'm going to check extraocular function. For the corneal light reflex, I'm going to bring my light in. Okay, the other side. Yep, so the corneal light reflex is symmetrical bilaterally. I'm now going to do the cover-uncover test. Can you cover one of your eyes? I'm going to check for nystagmus. Okay, we'll do the other side. Okay, no nystagmus noted bilaterally. We're now going to check for extraocular movement. Can you follow my pen with your eyes only and don't move your head? Okay, extraocular movement is intact. Now I'm going to check your pupils. Okay, I'm going to shine my light in for reaction, and I'm going to shine my light in again for indirect reaction. Okay. Now I'm going to have you look with both your eyes at my light, and I'm going to bring my light forward. Okay, so pupils are equal, round, reactive to light, and accommodation. Okay, now I'm going to do the fundoscopic exam. So I'm first going to identify the red reflex. Perfect, I'm going to come in closer. Okay, the optic disc is visualized. It is creamy pink in color with well-defined margins. The general background is consistently red-orange, and the vessels are visualized, and the macula is to the left temporal side. Okay. No papilla edema noted. We're gonna now do an exam on the ears. So I'm first gonna check the external auricle. Okay, I'm gonna palpate the lobe, palpate the mastoid process. Any tenderness?
No.
Okay, I'm gonna palpate the tragus. Any tenderness?
No.
Okay. Now I'm gonna do an internal exam on the ear. I'm gonna pull the pin up and back. Okay, the tympanic membrane is pearly gray. No nodules or lesions, and the cone of light is appropriate. Mild cerebrum noted. Okay, we are now going to test your hearing. I'm going to do the whisper test. So I'm going to have you cover one ear. I'm going to whisper 2 words, and you're going to repeat them. Apple.
Apple.
Orange.
Orange.
All right, we're going to do it on the other side now. Pear.
Pear.
Banana.
Banana.
Okay, hearing is intact. If there were any hearing deficit noted, I would then perform the Weber and Rhine test. So I'm going to perform the Weber test. So I'm going to put the tuning fork on the top of your head, and let me know if you hear the sound equally on both sides or if you hear it more so on one side or the other. Okay? Do you hear it equally on both sides?
Yes.
Okay.
Both sides.
So now I'm going to perform the Rhine test, which measures air conduction if it's greater than bone conduction. I'm going to now place the tuning fork on the mastoid process, and then you're going to let me know when you don't hear the vibration, and I'll move it to your ear.
Okay.
Okay?
Okay.
Do you still hear it?
Yes.
Okay. And I would then perform that on the other side. Okay, I'm now going to perform an exam on your nose. First, going to inspect the nose. It is symmetrical, it is midline and proportionate to other facial features. No nasal discharge noted. I'm going to test for nasal patency. So I'm going to have you push one nair closed and sniff, and we'll do it on the other side. Okay, nasal patency is intact. I'm going to look at the internal nasal cavity. Can you look back for me? Okay, perfect. No edema or erythema noted, no deviation or perforation noted, or foreign objects. I would then do that on the other side. Now going to check your sinuses. So I'm going to press on your frontal sinuses. Any tenderness?
No.
Okay, I'm going to press on your maxillary sinuses. Any tenderness?
No.
Okay. So sinuses are non-tender. Now perform an exam on the mouth and throat. So I'm first looking at the lips. They are pink in color, no lesions noted. Can you pull your lower lip down for me? Okay, no lesions noted on the lower lip. Okay, can you smile for me? Teeth are straight, they're white, and they're evenly spaced. Okay, open your mouth up wide. Okay, I'm looking at the tongue. It is pink in color, no lesions noted. Can you swing your tongue to the right? Okay, no lesions noted there. To the other side, no lesions noted there. I'm going to look at the ventral surface of the tongue. Can you put your tongue to the roof of your mouth? Okay, the ventral surface is smooth. Now I'm going to check the buccal mucosa. Okay, no lesions noted. The mucosa is moist bilaterally. Okay, I'm going to look at the uvula now. Say ah. Okay, the uvula rises midline in phonation, and the tonsils are visible, grade +2. Okay. Thank you, Stephanie.
Thank you.
Do you have any questions for me?
Nope.
Okay.